The sixth stage is evaluation, and the seventh stage is that sort of stages of iterative improvement. So let's talk a little bit about assessment, because I think that's a particularly challenging one. And unfortunately, it's one that often falls off the map until after the course has happened, or maybe you're halfway through the course and you think, oh, I have to write the exam still, or I still have to do this sort of assessment and learn whether or not my learners are where they're supposed to be. Remember, there's two things at least that you can assess. You can assess your learners, have they picked up what you wanted them to pick up, but you can also assess the overall quality of the curriculum and maybe the impact that your curriculum has had. So there's a couple of models that I'll show. I'll just show Miller's pyramid quickly and then move on to some of the Kirkpatrick levels of evaluation. So Miller's pyramid is a skills acquisition model. So it gives you an idea of the stages that a learner goes through when they're trying to learn a skill. And I'll just show you this pyramid. So here at the bottom pyramid, this is sort of just the informational level. A learner knows how to do a physical exam, or a learner knows what a physical exam is and the steps. And then the next level is they know how to do it. So they know sort of the sequence of how to do it. The level above that is they can actually show it. So here's the kinesthetic part where they're demonstrating a skill, and they can show you probably in a slower time or maybe in a role play that they can do it. And then the top level of the pyramid is they actually do it. So if you're really wanting to integrate those skills, maybe it's substance use screening, maybe it's doing cognitive behavioral therapy, teaching them what it is, teaching them sort of how the steps that you would go through, letting them do some supervised role play practice, and then actually having them work with patients under your supervision sort of brings them to the top level of that pyramid. Kirkpatrick level helps us to think more about the impact that our program has had. And it can be a program, it could be a session. So we want to think about, again, sort of starting at the bottom and moving up. It's not usually framed as a pyramid, but you could think about it that way too. So level one is at the bottom, and that's most commonly used. This is the learner's reaction to the curriculum. So when you have a continuing education session and they say on a scale of 1 to 5, how satisfied are you with the teaching that you've just experienced? That is an assessment of your reaction. Satisfaction and reaction is important because you then have an idea of the experience of the learner. However, I would encourage you not to stop at reactions. A lot of times folks do stop at that reaction level because it's quick and it's easy and you don't want to overburden learners. I don't want to overburden learners. The next level up is learning. So you might have an exam, you might have them demonstrate what they've learned and then grade their ability to deliver the skills that you have taught them. So it's not just did they like the curriculum, did they change? Did your learners change? The next level up is behavior. So after taking your webinar, did your learner go to clinic and effectively use the substance use screeners that you just taught them? In their clinical practice, are they now prescribing naloxone or providing naloxone to anyone that has been on chronic opioids? So you want to see if there's been a change, a meaningful change in their behavior. And then the level 4, which is the hardest level to get to, has your organization changed as a consequence of training? Has the climate changed, the culture changed, the billing practices, the documentation practices, the number of people getting X-waivered to prescribe buprenorphine? Can you show that there are concrete changes in your organization? Okay. Here are some examples of different evaluation tools: tests of attitudes, surveys, interviews, peer reports. Tests of knowledge, multiple choice are popular. They're hard to write, quality multiple choice questions. OEQs are open-ended questions similar to short answers. So you'll have maybe a case vignette and then the learner will write a paragraph or so in answer. There may be applied case exercises, oral exams. To test skills and competence, maybe direct observations, simulations, or maybe real-world observations. You might also indirectly look at chart reviews and chart notes that your learners have written. And you might also go to patients and peers to get feedback on how competently your learners have been.